DIY Homemade Medical Face Mask. How to make your medical reusable face mask for flu protection. Do it yourself in 10 simple steps, with pictures, for adults and kids. Written by DIY Homemade Publishing. Narrated by Michael Lakemen. Introduction. Prevention of infectious and viral diseases includes regular hand washing, the use of an antiseptic, and the wearing of a medical mask. This is the information that the WHO provides, and in this ebook you will learn how to sew this mask on your own. Of course, you can also buy a medical mask at a pharmacy. However, the demand for these products is so high that consumers are constantly complaining about their high prices and lack of stockpiles. There is a solution. Create a mask using the simple lessons described in this short guide. In the age of colds and infections, medical masks can help prevent disease. However, if you cannot find the mask at the pharmacy, you can make it with your own hands. Of course, such masks do not exactly match factory masks, but do offer good protection. In addition, the cloth mask can be cleaned and reused. A medical mask plays an important role in ensuring safety against infectious and viral diseases that are transmitted by airborne droplets. Especially in emergency situation like the pandemic happening right now, it is not so easy to find this thing on the shelves of the pharmacy, so you have to cope on your own, which is much more profitable. You can, of course, order them on the internet with delivery, but the price is pretty high at the moment. There are, of course, many frills on how to wear a mask, and who needs to do it. There are some algorithms for wearing and manufacturing it. We will cover the manufacturing of your own mask later in the book. But first, a bit of theory. When is a mask needed? As mentioned earlier, a mask is an integral element in protecting against viruses. Without them, it is impossible to imagine working in medical institutions and in other specific areas. Normally, going down the street with a mask is an extremely useless activity because the concentration of microbial organisms in the air is very low. In addition, even if a person wears it for his own peace of mind, you need to understand that it can be warm outside, or a person is in a hurry somewhere and begins to unconsciously breathe through his mouth, which deforms the mask. It turns out that it already does not carry any benefit in itself. But the person continues to breathe, not with air, but with his own bacteria. And if he enters a bus, a train, or a room full of people, he risks becoming infected, more than those who do not have a mask at all. In the current time being, unfortunately, the health institutions have advised us to wear facial masks when outside. We now proceed to explain why. Chapter 1. Why should everyone wear face masks? Scientists explain. There is no scientifically substantiated evidence to conclude that wearing masks is ineffective. On the contrary, the latest biological findings regarding the penetration of the new infectious disease into human tissues suggest that the main mechanism of virus transmission are not small sprays, but large droplets, and therefore wearing a surgical mask by everyone guarantees a higher level of protection. In the current escalating pandemic, there's been a lot of emotional talk about wearing facial masks. The World Health Organization has still not issued a document recommending the wearing of masks to healthy people, and does not recommend them as a means of preventing infection. According to WHO recommendations, face masks should be worn by people with infectious disease, people suspected of having infection or having symptoms such as coughing or sneezing, persons caring for patients with infectious disease, or persons suspected of having infectious disease. Some days ago, the WHO, through one of its representatives, reminded us that wearing masks is not always good for our health. It has also been reported that wearing them is only effective when combined with frequent hand washing with soap and water, or disinfection with alcohol-based agents. Dr. Mike Ryan said, "There is no scientific evidence that there is no benefit in the mass population or wearing of masks. On the contrary, there is evidence that misuse of masks causes
Sample complete. Ready to continue?